Hello once again, and welcome to the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. As you know, the Georgetown Hospital has been in the forefront of the COVID-19 battle, and we're very fortunate that we still have a competent, dedicated cadre of staff that have been with us from the beginning of this pandemic. Today, as usual, I'm wearing my mask to cover both my nose and mouth, and I will take it off since I'm alone here while we're recording for you. Remember, if you have any questions or comments, please feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. So yesterday we started a discussion about COVID-19 and its effects on the heart. I know a little bit about this as a cardiologist, and a lot of my patients have pretty much the same question because they're all heart patients and they want to know, how does COVID-19 affect the heart? What are the implications? Should they take vaccines? Should they modify their medications? Should they stop the medications? Should they take extra medications? What they can do, activity-wise? Can they take alcohol while they are, taking medications for the heart, etc.? But today we're going to focus a little bit about the way the coronavirus interacts with the cardiovascular system. Yesterday we talked about heart failure, we talked about heart rhythm conditions, we talked about blockages, etc. We're going to spend some more time and discuss these in details and from a different point of view as well. So the way in which the coronavirus infection interacts with the cardiovascular system is becoming more and more well known. The primary target that seems to be affected is blood pressure. And people can have, when it gets really bad, they can end up with low blood pressure, or what we call hypotension. They can have fast heart rates, or what we call tachycardia. They can have slow heart rates, which we call bradycardia. They can have irregular rhythms, which known as arrhythmias. And unfortunately, some people can develop what we call sudden cardiac death. That is a type of heart rhythm that can occur where the heart does not effectively pump out any blood, and essentially people can die if not rescued by some kind of emergency measures. So normal blood pressure, generally the top number should be between 90 to 130, and the bottom number, known as the diastolic, should be somewhere between 60 to 90. When you get below those numbers, people can start to develop symptoms. And the common symptoms during, let's say, low blood pressure would be, again, dizziness, lightheadedness. Some people may even faint. And, this is an important one, especially in older patients who may be taking medications for high blood pressure. If it falls too low, and if this person is, for example, lying down and they try to get up suddenly, they might find that they get dizzy, they might complain that the room is spinning when they get up and they can't see properly. And so these are things that can occur, especially in older people. And when that occurs, some persons may fall, and when you fall, you can injure all kinds of things. You could injure your head, they can have bleeding in the head, they can break an arm, so these are all potential dangers that are secondary to low blood pressure. In tachycardia, bradycardia, again, they can feel heart fluttering in fast heart rate. and that can also be associated with lightheadedness and dizziness. The slow heart rate, especially in older people, is just as dangerous. They can have the dizziness, they can have lightheadedness, they can faint or feel like fainting, something we call near syncope. Arrhythmia, the most common one is atrial fibrillation. So you were born with your normal pacemaker somewhere in the top of the right side of the heart. When that works well, the rhythm is very regular and people feel fine. Under certain circumstances, other areas in the heart decide to compete with your natural pacemaker. But they beat fast and they beat irregular in a very noisy manner, so to speak, and things become chaotic. There is no organized contraction of the heart. So it's irregular and it's fast. And that, when it happens as at the top part of the heart, we call it atrial fibrillation. Now, there are significant secondary comorbidities associated here, and cardiovascular disease is very common in infected patients who are hospitalized. And people with pre-existing cardiovascular disease are at higher risk for adverse events of this infection and with respiratory viruses in general. When we talk about adverse events, what we're talking about, the worst of the lot, of course, is death. But then there's also the chance of being put on a ventilator, being admitted to ICU. Because being put on a ventilator and admitted to ICU has its own types of complications. There's all kinds of other outcomes associated with hospitalization in an ICU. You can pick up more powerful infections. If you're lying down too long in one position, you can develop clots in the legs or anywhere else. They can develop ulcers at pressure points in the back, in the heel, etc. So these are all potentially bad outcomes for people being in ICU setting. Infection with COVID-19 virus can also cause or contribute to unstable cardiovascular disease. So you may have chronic stable cardiovascular disease, but once you're infected with the virus, what has been stable and controlled for years can suddenly become unstable and uncontrolled. You can have more angina, you can have more severe symptoms of heart failure, etc. So it's important to understand the way that this virus affects the cardiovascular system. Heart failure is one of the common outcomes in COVID-19 infection affecting the heart. And what is heart failure? Again, there is a mismatch between the demand and supply of blood. When you're walking up the steps, for example, or you're running or you're walking quickly, you need increased blood flow. You need increased blood to be sent to your muscles because the blood takes oxygen. And what sends the blood there? It's the pumping strength of the heart. So if the heart muscle is sick and it cannot pump the blood, then when you need more blood, you're unable to meet that demand. And as a result, blood can then build up in the lungs and cause shortness of breath. And that is what we call heart failure, or a type of heart failure. There are a couple of different types. So way back in the early stages of COVID-19, people have recognized the increased incidence of heart failure in COVID-19 patients. And as we got more and more into the pandemic, as more time elapsed, we have been seeing more and more people ending up in heart failure. Right now, at this time in 2021, almost 7% of COVID-19 patients end up in heart failure. And that's a very, very staggering statistic, because it means that 7 out of 100 people who are infected with COVID-19 and get into hospital can develop heart failure. It is still too early to know whether the heart failure is going to be long-lasting or if it's something that will clear once the person has cleared the virus and if they've received their vaccines, etc., and how they will respond. The main reason for these people to develop heart failure is what we call myocarditis. Myocarditis simply means myo is for muscle and carditis is from the heart. And itis is usually inflammation, right? So heart muscle inflammation. An inflamed heart is a dysfunctional heart. And the inflamed heart muscle is a dysfunctional heart muscle. So it means that this heart muscle immediately cannot pump as well as it should to send blood across the body. But more importantly, or just as important, it cannot also conduct electricity efficiently. And when that happens, you can have abnormal electrical circuits, some of which can be fatal. The heart is controlled by electrical activity. That is how it is told how to contract and how to relax. That's an electrical process. So if you have inflammation, the electrical process will be disrupted and current will flow in abnormal directions and cause abnormal movements of the heart muscle, etc. And that can lead to severe problems in patients. So you look at a particular study that evaluated heart rhythm conditions in about 700 persons who were admitted to an ICU. These persons were at least 50 years old, 45% male, and 69% of these were persons of color. If you look at what happened, a significant number of them would have developed cardiac arrest in an ICU. That's 11%. So that's more than 1 in 10. So 11 out of 100 persons would have developed cardiac arrest. And in the non-ICU population, that was a different statistic as well. And the commonest of these incidents that led to cardiac arrest is atrial fibrillation that we spoke about. What it means that if you are admitted to the ICU, there's a 10-fold increase in the risk of developing an arrhythmia. And cardiac arrest, if you do develop a cardiac arrest in hospital, even in the best of circumstances, there is an increase in death among these patients. So the goal is to reduce the inflammation, to reduce the infection in the first place, and reducing the severity of the infection if you actually do get it. So that is how COVID-19 affects the heart muscle to create heart failure, how it affects the electrical system to cause abnormal heart rhythm, and then the next thing that it can cause is something that resembles heart attack and heart attack itself. So one should not ignore symptoms that are suggestive of heart attacks in the COVID era. So even during COVID, if you are getting chest pain, you are getting shortness of breath with sweating and fast heart rates, etc., it is important to take it in hand. Chest pain is very important, especially in patients who are known to have the risk factors: diabetes, hypertension, obesity, family history, smoking, etc. So if you have chest pain, do not ignore it. Difficulty in breathing is another marker for heart disease. Or if you have chest discomfort or any discomfort that moves to the arms, the back, the neck, the shoulder, or the jaw. This can be warning signs of a heart attack, and it's important not to ignore it because COVID-19 can increase your risk for heart disease. But even if there's no COVID-19, you should not ignore these things. So I hope this would have helped us again to understand a little bit more about COVID-19, its effects on the heart, and what you should do, etc. If you have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me, and I'll see you next time.